Hello, and welcome back to another video. In this video, we're going to talk about a different, unique industry that's also going wild and crazy and bonkers in the world of recruiting. Let's talk about tips for recruiting in the healthcare industry. Let's get started. If you are as excited as I am, though, before we get into it, please consider supporting a fellow recruiter. Give us a like, subscribe, click that bell. Honestly, it would make my day and help us, inspire us to make more of these content just for you. Let's get into this. So let's overall talk about the current healthcare job market. So overall, healthcare added about 56,200 jobs in April, which is consistent with the average monthly gain of 63,000 over the past year. The numbers came from the latest BLS report published in May, and we're seeing overall the healthcare job market is experiencing steady growth in job openings, with specific areas showing notable increases in employment. To go a little bit deeper, sector specifics, ambulatory health services, we saw 33,400 jobs added. For hospitals, we've seen 13,500 jobs added. For nursing residential care facilities, we've seen 9,300 jobs added. Other areas, physician offices added 5,600 jobs, and home healthcare services added 19,300 jobs. As you know, with every job market, it's constantly evolving, right? There are more job openings available than there are people in the workforce to fill them. Yet, healthcare continues to grow in job openings. While a steady growth seems positive, we also just need to make sure we do keep in mind the demand is outweighing the supply of people available in the workforce, which can also cause its own unique challenges. Let's talk about healthcare job market trends. So number one, the obvious, the impact of the pandemic on healthcare employment. So the initial impact, the pandemic led to a decline in healthcare employment naturally, especially in ambulatory services and hospitals due to closures and reduced elective services. Ambulatory services experienced the deepest decline with a 16% drop in 2020 of April, while hospitals saw a prolonged reduction of staff in 2021. Now, in terms of recovery, healthcare employment has been recovering since 2022, particularly in ambulatory care and also hospitals as patients continue to resume elective care and outpatient services. In early as January of 2024 of this year, nursing residential care facilities added 16,000 jobs, ambulatory care settings gained 33,400 jobs, and hospitals saw an increase of 20,400 jobs. Overall, healthcare employment has grown by approximately 4.6% since February of 2020. So hospitals and physician offices, these are the largest employers within the health sector, employing about 31% and 17% of health sector workers respectively. Did you just start your own recruitment agency and are struggling getting your own clients? Are you thinking about starting your own agency but afraid to make the jump? Do you have your own clients but you're struggling to find the perfect candidates fast? Do you have a full-time job and want to do recruitment part-time to make more money on the side and have no idea how to? If you answered yes to any of these questions, please consider joining our private community. It is a trust-based community where recruiters around the world can support, collaborate, and work together on placements all around the year consistently. In this community, you will directly have access to the real open jobs of my team and of our members, and you will also have the chance to access trainings, events, giveaways, and much, much more. If you are part of this community, I communicate and work with you as if you were on my own team, and I'll do whatever I can to do a placement together with your client or candidate. So if you're struggling to get your own clients or candidates and you want a way you can make sure you can be busy all year round by having access to many more open roles, then this is something you need to look into. This is open to people around the world and is open for recruiters in every industry and experience levels, as we will always have a good number of variety of open jobs across sectors, markets, and industries. I'm really happy to say that within the first 30 days, we have already have a new member with minimal recruiting experience do his first placement that had a total fee of almost 30,000 US dollars, and we are working hard to do many more this year. If you are interested and excited, there are only a limited number of spots open, so make sure you sign up quick at patreon.com/recruiterpreston. If you have any questions, please reach out to me on LinkedIn, Instagram, or Discord. We can set up a time to chat. See you on the other side. The next is the distribution of employment across healthcare settings. So hospitals and physician offices, these are the largest employers within the health sector, employing about 31% and 17% of health sector workers respectively. Elderly care and skilled nursing facilities, these sectors have not yet fully rebounded that we're seeing from the data, with skilled nurses facilities seeing an 8.3% drop in employment and elderly care facilities experiencing 1% decrease from February 2020 to February 2024. Job growth, quits, and unemployment rates. What could this all mean? So in terms of job growth, we're seeing job openings in healthcare and social assistance sectors have increased more than 50% higher than pre-pandemic levels, compared to less than 30% increase across all sectors. The healthcare again reported a 66,700 job increase in February 2024, In terms of job quits and unemployment, we're seeing healthcare surge during the pandemic, but since stabilized to slightly below pre-pandemic levels by January 2024. Unemployment rates for healthcare workers have returned to pre-pandemic levels, with variations between hospital and non-hospital workers. In terms of wages and earnings in healthcare, so what are some of the general trends that we're seeing? Healthcare wage growth was 2.9% year over year as of December 2023, with the nursing and residential care sector experiencing the highest wage increase at 4%. In terms of sector variance, we're kind of seeing wage growth is present across the board. The highest increases are seen in sectors still recovering from the pandemic-induced workforce reductions. Lastly, sector-specific trends. Employment and health services have recovered to pre-pandemic levels, but remained low, below the expected growth trends. And also employment in residential mental health and substance use disorder facilities have also rebounded, but overall, nursing and residential care settings have not fully returned to pre-pandemic employment levels. Let's talk about the talent shortage. So this is one of the primary challenges facing healthcare recruiting in 2024 right now. So what are some of the factors contributing to medical staffing shortages? Well, the pandemic impact, it significantly strained healthcare workers, leading to high burnout rates. According to a survey between April and December 2020, 50% of healthcare workers reported burnout. This has driven many to just leave the profession entirely. You got pre-existing shortages. So even before the pandemic, the healthcare industry was facing shortages. A 2019 report from the Association of American Medical Colleges predicted a shortage between 37,800 and 124,000 physicians by 2031. Demographic shifts. So many baby boomers and Gen Zers are retiring, creating room in healthcare workforce. This reduction is not being matched by new entrants into the field. Work-life balance. The demanding nature of healthcare roles, especially those requiring night shifts and weekend roles, make it challenging to attract and retain staff. Many potential workers are opting for jobs in other industries that offer better work-life balance. Lastly, support demand imbalance. As the population ages and the healthcare grows, there is going to be a significant shortage of qualified healthcare professionals to meet increasing demand. This creates a competitive environment among healthcare organizations trying to recruit from a teeny tiny limited pool of talent. What about employment shortage in specific sectors? Well, for nursing and residential care, despite recent gains, employment remains 4.6% below pre-pandemic levels, with a shortfall of over 154,000 jobs. For alternative care preferences, well, patients increasingly prefer alternative care options like aging-in-place programs, contributing to the slower recovery in traditional nursing and residential care settings. Now let's talk about the talent shortage impact on patient care. So healthcare providers are seeing more patients, leading to shorter appointments and longer workdays. With limited time per patient, communication can suffer, increasing the risk of misunderstanding and potentially malpractice. Overwork and understaffed teams can cause a potential decline in patient care quality. There's two things. So one is the talent shortage impact on existing healthcare professionals. So as we talked about the workload and stress, they often face demanding work environments, healthcare professionals with high patient volumes, complex cases, and long hours. This can lead to physical and emotional exhaustion, contributing to burnout. Also the emotional toll, right? Dealing with challenging patient situations, ethical dilemmas, intense emotional experiences can also take a toll on people's well-being. Without adequate infrastructure or support system, burnouts can escalate, and retention challenges. Burnouts can contribute to increased turnover rates, as healthcare professionals may seek roles with lower stress levels or better work-life balance. Addressing burnout is crucial for retaining experienced professionals and maintaining a sustainable healthcare workforce. What about the talent shortage impact on high turnover rates? Well, you got demand versus supply, right? Demand for healthcare services often outpace the supply of qualified professionals, leading to high turnover, as healthcare workers may seek better opportunities or face burnout due to workload pressures. Job satisfaction. Healthcare professionals may leave their positions due to factors like inadequate support, limited career advancements, or dissatisfaction with working conditions. This turnover can strain healthcare organizations and compromise continuity of care for patients. Lastly, what about the impact of quality, right? High turnover rates can contribute to instability in healthcare teams, affecting collaboration and communication among staff members. This can ultimately impact the quality and consistency of patient care. What about longer time to fill periods? Well, as an example, for RN or registered nurses, time required to hire these guys is significant, often taking around 3 months. For some specialties such as medical surgical RNs, it takes 94 days. Critical care RNs and operating room RNs are also a long time to recruit, averaging 83 and 92 days respectively. What about competition from non-traditional employers? Well, Google, Amazon, Walmart are all entering the healthcare space, offering jobs that combine healthcare expertise with technology or retail services. You got Amazon Healthcare, Alphabet Healthcare, Microsoft Healthcare. They'll offer potentially more competitive compensation, perks, and incentives. This could be luring healthcare professionals away from traditional healthcare settings for better opportunity. About 1 in 5 healthcare workers have left medicine since the pandemic began. Since the pandemic started, 18% quit, 12% have been laid off, and 31% consider leaving. In 2022, nearly 1.7 million people quit their healthcare jobs, equivalent equivalent to almost 3% of the healthcare workforce. What are some of the possible reasons for employment departure? Well, many healthcare roles lack clear pathways for career development, which can lead to more motivating when pay increases with other employers. Employees leave for opportunities to offer career growth, even if it means moving to a related field outside of clinical medicine. Despite potentially high earnings, some workers find their compensation inadequate, especially in light of student debt and cost of living. There's better paying opportunities, right, in other fields that will entice healthcare workers to leave, seeking financial stability and more sustainable career. Amazon Healthcare, in terms of Amazon Healthcare, you got Amazon Web Services, which provide cloud solutions to streamline data management for healthcare providers, PillPack, an online pharmacy service offering convenient medication delivery, Amazon Care, a telehealth service, Alexa, integrated with health-related skills, medical supply chain, uses its distribution power to deliver medical supplies efficiently, and Haven, a health venture aimed at improving healthcare. The impacts of these, hospitals and clinics benefit from enhanced supply chain efficiency and cloud services, and traditional pharmacies and smaller telehealth providers face stiff competition from Amazon's extensive resources and infrastructure. What about Apple? Well, you got Apple Watch, equipped with health features like ECG monitoring, fall detection, fitness tracking, health records, an iPhone feature that integrates with healthcare provider systems to streamline patients' data, genetic testing, partnering with health systems for advanced diagnostics. Impact are endless, but consumers and healthcare providers benefit from better patient engagement and monitoring through wearable technology. Competing wearable manufacturers and traditional health monitoring devices may lose market share. And then you got Alphabet, right? Google Fit, fitness tracking platform, integrated with Android services. You got DeepMind, uses AI for advanced medical research and diagnostics. You got Verily, focuses on life sciences and healthcare solutions. You got Calico, aimed at understanding aging and extending human lifespans. And you got Fitbit, a wearable, enhanced health tracking capabilities. Again, healthcare providers gain from improved data analytics and AI-driven insights and enhancing precision medicine and research capabilities. And lastly, you got Microsoft Healthcare. They got Microsoft Cloud for healthcare, provides tailored cloud services for healthcare needs. Healthcare Next to integrate AI and cloud computing with clinical workflows. You got Microsoft Genomics, genomic data analytics tool, Medical Scribe, AI drive tools to assist in clinical documentation. And lastly, Microsoft Health Bot, conversational AI for patient engagement and support. So what are some of the tips for optimizing healthcare recruiting? Well, you can integrate technology and recruitment strategies. You can reduce time to fill from like the average 80, 90 days we talked about before. You can build strategic talent pipelines. You can diversify sourcing needs to help you uncover best-in-class talent, or you can even focus on long-term recruitment strategies and focus more on the longer game instead of just getting frustrated that you can't talk or find someone or have someone respond to you in the short-term game, or utilizing KPIs that skews drastically on the short term. What are some of the technologies that you can leverage? Well, online job platforms have become essential for connecting employers with qualified candidates. Specialized healthcare job boards, you can check out Dr. CPR. You can also check out hospitalrecruiting.com, Health eCareers Network, Indeed Elite Learning. You can also use AI to analyze resumes, relevant skills, and match candidates with job requirements, video interviews and assessments, use big data to identify trends, forecast workforce trends, and predict potential turnover, and lastly, make job opportunities accessible on mobile devices. The integration overall of technology into healthcare is revolutionizing the process, making it just more efficient and effective, and that should be the end goal. Digital strategies are crucial for attracting and retaining top talent, and healthcare organizations that embrace these technologies will be better positioned, in our opinion, to build a workforce, ensuring that they can meet the increased demands of the healthcare industry. Reduce time to fill, right? So the chronic shortage of healthcare workers make finding and retaining top talent more critical and difficult than ever. Filling vacancies quickly in healthcare organizations is essential in maintaining high standards of patient care. Strategies to ensure your client is staffed with qualified healthcare professionals without unnecessary delays. You can help, for example, define their needs, ensure that healthcare recruiters, the teams, managers collaborate closely to align recruitment process with the specific needs and requirements of each department, clearly define the requisition needs so that the job postings attract high quality, correct candidates, and streamline the communication. You can contact potential hires quickly, immediate outreach, use scheduling tools, continued engagement. You can move quickly on making an offer. Think swift decision making. Do not delay making an offer while waiting for the other candidates to complete their interviews. It's very, very competitive. The faster you make an offer to one candidate, the higher the chance you can get them. Soft deadlines, right? Don't make it open-ended. You stick with the deadlines so that you can methodically go through your candidates at a systematic pace. Have open communication with stakeholders, right? Think about feedback timings. Think about strong candidate vetting. Ensure that candidates for the stakeholders are well vetted and meet the basic requirements. Lastly, get approval in advance. Pre-approved details, have contracts, compensation packages, and job requirements approved, ready to go before posting the job. Have clear need definitions. Define the exact need and approvals for the positions to avoid any delays. You want to build a strategic talent pipeline. Well, you want to identify your needs, right? Start filling your hiring pipelines. Engage and nurture candidates in the pipelines, and then monitor and analyze the pipeline. Reference our previous YouTube videos on how to build a talent pipeline whenever it gets published. The important thing here is you want to create effective healthcare recruiting and staffing pipeline, which will essentially involve strategic planning, proactive engagement with various sources of talent. By building an effective pipeline, healthcare organizations can ensure a steady flow of qualified professionals to meet the ongoing demand for skilled healthcare workers. Use diversity sourcing methods. So partner with an RPO provider. Top healthcare RPO providers are Vanator, Celio, PeopleScout, Manpower, right? Partnering with a recruitment process outsourcing provider known as RPO who has expertise in healthcare recruitment can source candidates from a wide variety of channels. They are not traditional staffing agencies or hunters. Instead, they implement comprehensive solutions designed to improve the hiring process, focusing on fulfilling specific healthcare hiring needs efficiently and effectively. Some of the key questions to ask prospective RPO providers would be, do they specialize in healthcare? Do they serve multiple healthcare organizations? Can they handle both small and large-scale hiring needs? Where and how do they source healthcare providers? You also want to attract headhunters, specialized agencies in healthcare as well. Use similar questions to vet them. Lastly, attract veterans and younger generations like Gen Z millennials and other diverse talent. Have nurses speak at job fairs, expose students to real-life experiences and insights into healthcare professions. Visit healthcare facilities, participate in field trips, showcase diverse healthcare roles that don't require extensive education. Partner with local hospitals, clinics, higher education institutions can provide students with exposure to healthcare settings and opportunities. Lastly, what are some long-term recruitment strategies to think about? You want to focus on long-term strategies and candidate relationships. You want to think beyond immediate hiring needs and build long-term relationships with candidates. You want to place top candidates who aren't a fit for current positions into a talent pool and maintain regular communications with them. This approach not only keeps candidates engaged, but also enhances your employer brand. Nurturing these relationships, you will ensure that you have a ready pool of talent for future openings, reducing the time and effort needed to fill critical positions. Again, develop talent pools and have great engagement and communication with potential candidates. Now, going back to you, how has the increasing number of job openings in healthcare impacted your recruitment strategies? Have you noticed a significant shift in the types of roles that are hardest to fill? Would love to hear your success or horror stories. Please share them below. But really appreciate you again. If you like this video, want to see more like it, feel free to give us a like, subscribe, click that bell. Thank you so much again. We'll see you on the next one.